Welcome to this overview of JPIGO's Gender Analysis Toolkit. The JPIGO Gender Analysis Toolkit for Health Systems is a practical guide for public health professionals seeking to understand how various roles, norms, needs, constraints, opportunities, and power pertaining to gender can impact health outcomes, both through service delivery and access to information and care. The purpose of the toolkit is to help you write the research questions that will guide data collection when you conduct a project-level gender analysis. It will help you decide what types of gender-related information should be included in your formative assessments, studies, and evaluations. It is also designed for those working at different levels of the health system to enhance their understanding of how gender impacts health outcomes. Beyond meeting donor requirements, the purpose of the gender analysis is to answer these key questions. How will anticipated results of the work affect women and men differently? How will the different roles and status of women and men affect the work to be undertaken? The tool presents illustrative, general, and health-related specific questions that are organized in matrices related to the different levels of the health system you see here. The toolkit provides illustrative questions related to these 5 domains described in United States Agency for International Development's USAID Automated Directive System ADS 205, which are access to assets. For example, if a man controls money or other assets in a household, he may not allocate funds for a woman to deliver in a facility. Beliefs and perceptions or norms. For example, there is a belief in many sub-Saharan African countries that a real man has a large number of children, or there is a belief in some societies held by both men and women that women deserve to be beaten or raped for transgressing expectations of what it is to be a woman, that she should be chaste, obedient, and certainly not out late at night by herself. Practices and participation. For example, in some societies, women and girls eat last even when pregnant. Institutions, laws, and policies. For example, national laws around the age of marriage are not always the same for males as they are for females. And finally, power, which pervades all domains and informs who has, can acquire, and can expend assets and decisions over one's body and children. Power determines if an individual can take advantage of opportunities, can exercise rights, move about and associate with others, enter into legal contracts, and run for and hold office. Power also determines the way men and women are treated by different types of institutions, policies, and laws. Ideally, a gender analysis should be conducted before or at the start of a project to inform its design. The findings provide the basis for developing gender-sensitive or responsive indicators. These indicators can be used to track reductions or increases in gender disparities in women and men's decision-making, resource control, and leadership, along with health indicators, disaggregated by sex, to monitor any differences in health outputs and outcomes for women, girls, men, and boys. If it is not possible to conduct a gender analysis at the beginning of a project, it can be useful to do one as a special study or part of a midterm evaluation. A gender analysis has 2 parts. In the first part, you identify inequalities, gaps, and disparities in a particular context. The process consists of collecting information and data on gender roles, relations, and identities related to specific health problems to identify gaps and disparities based on gender differences. The tables in Section 5 of the toolkit provide key questions for a range of JPIGO health areas that can help with designing studies and assessments to collect this information. In the second part, you analyze the information collected on gender differences to determine and prioritize gender-based constraints and opportunities and their implications for achieving health objectives and the equal status of women and men. Section 6 of the toolkit provides further guidance on how to analyze the data collected, with a particular focus on how to identify gender-based constraints and opportunities, which will inform the project design and M&E processes. Here you see the 7 key steps of a gender analysis. 1. A secondary data collection plan. 2. Review of secondary data sources. 3. Analyses of secondary data. 4. Identification of critical information, gaps, and contradictions. 5. Development of a primary data collection plan and instrument. 6. Data analysis. 7. Constraints analysis. The JPIGO Gender Analysis Toolkit focuses principally on steps 4 and 5, the identification of critical information gaps and the development and implementation of a primary data collection plan. Primary data is information gathered for the first time by a researcher through their direct effort and experience for responding to a research problem. Secondary data is information that has already been collected by another person or organization for a purpose that is not related to the current research problem. It is readily available from sources like demographic health surveys, ministries of health, reports, journal articles, websites, and the like. The toolkit uses the gender analysis framework to organize questions for collecting information about gender relations and roles in the context of health programming. The questions that appear in the tables show the types of information collected as part of a gender analysis. These are not meant to be comprehensive. What can happen if a gender analysis is not completed? Here are some examples by domain. Individual. At the individual level, the access to assets, knowledge, and roles one plays based on gender are very important to understand. For example, while digital health is now a major approach for advancing health, many women are still much less likely to have access to a cell phone, depending on the country. This analysis is important for understanding who can be reached through health SMS messaging and apps, for example. Interpersonal. An important demonstration of not understanding gender dynamics are policies developed to prevent HIV without understanding of the lack of agency or power a woman may have in her relationship to implement recommendations or requirements that are intended to promote her health. For example, Thailand's 100% condom use policy with sex workers initially failed because sex workers did not feel able to insist on condom use with clients, or clients paid sex workers not to use condoms. It was not until the policy was enforced by brothel owners that there was a decline in HIV rates. Similar policies on male involvement in prevention of mother-to-child transmission, which are popular in sub-Saharan Africa, often require women to bring a partner with her to receive services. The result is that many women do not receive services because they are unable to get a male partner to accompany them to the facility. Community. Understanding gender norms and attitudes as barriers to promoting health behavior can be critical for deciding how best to design an intervention or promote a health service or technology. For example, in Malawi, the word for vasectomy is the same as for impotent, which conflicts with notions of manhood. Similar beliefs exist surrounding male circumcision in Uganda, which thus can limit uptake of the procedure. Health facility. Birth companionship has been identified as an indicator for respectful maternity care by many initiatives. But this does not recognize that it could in fact take away a woman's agency to have a birth companion in the birthing room. Moreover, health workers themselves face many gender inequalities. Studies have shown that the majority of frontline health workers are female and very poorly paid. They face discrimination in the form of low confidence in their abilities and also must deal with harassment and abuse as they work. A study in South Africa of nurses found that nurses hold many attitudes supportive of violence, making it a challenge to expect them to counsel, treat, and empower survivors of gender-based violence. We hope you found this JPIGO learning moment to be a helpful introduction to the Gender Analysis Toolkit. For further questions, please contact the Gender Technical Director.